Well, as coronavirus cases continue to surge here and across the state of Texas, doctors are noticing that some healthcare workers and patients are suffering from post-traumatic stress disorder as a result of the virus. KLBK's Grace Moore spoke to two women who faced COVID head-on and now are struggling with their mental health. Now, Grace, how are they doing?
Leah, one woman I spoke to had the virus back in July, while the other worked with COVID patients in New York back in April. Both women say they're feeling better, but it's been tough. They both still feel the effects of their experiences today. After watching her mother fight the virus, in July, Nikki Gillick got sick herself. And while she's recovered physically, she says for some time, COVID robbed her of her sense of self.
This isn't who I am, and not being able to understand how to be myself and get through.
Almost 4 months later, Gillick still has a cough and continues to recover from the mental toll the virus took.
Just mentally in my brain, my thought process, no longer I think is normal. The way that I think about things, it takes a minute for me.
Lindsay Shum is a registered nurse at Covenant Children's. Back in April, she was sent on assignment to New York to help hospitals there deal with COVID patients.
People would say, "Oh my gosh, how was it? How was it?" And all I could say is, it was wild, it was crazy. Just believe what the media is telling you. I couldn't talk about it.
And with the uncertainty of the virus still hanging in the air,
I think COVID is very nerve-wracking and anxiety-inducing because we don't know what it's like. We don't know who it'll affect and how.
Counselors say being more anxious or stressed is normal.
With relation to COVID, I think what we would be seeing is people who are developing a fear of maybe leaving their home, or obsessively washing their hands, or feeling like I can't go out, or I'm not going to be safe, or my family's not going to be safe, or my kids aren't going to be safe.
And reminding us, as we go through this pandemic, there's no shame in asking for help.
And you just have to know that you are going to feel all the feels, and that the feels are okay, and you're going to get through those feels, and at the end of the day, you're going to be okay.
Martina says one of the best things you can do if you're feeling stressed or overwhelmed is to talk to a therapist, a family member, or someone you trust. Leah?